Hey, this is Katy Jeter with the Public Affairs Program here on KNDY. Community Memorial Healthcare recently completed a series of town hall meetings regarding the sales tax question, which will be on the November ballot, calling for renewal of the half-cent countywide sales tax in Marshall County toward hospital operations at CMH. Administrator Curtis Hawkins led the discussions and noted recent inflationary and upward cost trends.
Just some other items of what we're seeing here locally. Obviously, we're all facing a very inflationary environment. It has affected our cash position. As we all know, whether you're buying insurance for your vehicles or your house insurance, similar for us as well. Our commercial property has went up about 25% recently, last couple of years. Just pretty much everything that we purchase and keeping it competitive with our wages for our staff, obviously has included in that inflationary environment. Workforce competition continues to be challenging. Everybody is vying for staff, and there is an acute nursing shortage in our country, whether it's locally, statewide, nationally. We all have to compete in that environment. We're seeing changing rural healthcare reimbursement, especially with some of the Medicare Advantage plans. The Medicare Advantage plans have grown, and they have come to the middle of America. They started big on the coast, and they now have arrived here, where the state of Kansas and our county has grown to about 20% people that are choosing Medicare Advantage. And that's very hard to work with. The pre-authorization requirements, the bureaucracy that they create to file claims continues to increase, and it makes it difficult. We've seen increases in costs for IT and our medical record capital expenditures. We did have a breach back in October where we had to wipe our servers down and start back over again and mount our data that we had backups, and all those things are getting more and more expensive. You can no longer buy anything anymore in the IT environment. It's all subscription based. You can't even buy a phone system anymore. That's subscription based, and so the firewalls and all those things that require constant updating are all based on subscription.
Hawkins did note of hope in rural healthcare.
I always like to, not dwell on the, oh, woe is me and all this kind of stuff, but, there's challenges no matter what you do and what industry you're involved in. There always will be challenges that you have to meet head on and overcome. And, as generally rural providers do more with less. I believe we have a good rural work ethic that we show up every day and do our level best for the folks that choose to live in rural America. I've always said that we should not have less health care because you choose to live in rural America. You deserve the same kind of health care that everybody else gets, and we need to do our level best to provide that.
CMH Administrator Curtis Hawkins praised the local staff and professionals providing service for the community.
Fundamental to rural America. We have a great healthcare system here, and I'm proud of that we have here. We have very qualified folks here that take care of the rural folks here, and we just ask you to help us continue that, because I think we can all be proud of the system that we have.
Public questions were addressed at town hall stops in Axtell, Marysville, at Valley Heights, Frankfort, and Beatty. The meetings were closed with an ask for support of the ballot initiative in November.
Sometimes we'll get asked a question about, what do you do with the money? And so it says, we use this to support the provision of healthcare services. So when we buy a piece of equipment or pay staff, we don't say the sales tax money is going towards this. I mean, it goes into our general fund, and we provide healthcare services with it. We don't isolate it and apply it to different pieces of our expenses, according to the ballot language. So we're asking you today to help keep our pulse strong here at CMH to continue to do what we all love to do each and every day. You know, we're not going to close tomorrow. We just ask for the support to keep us strong so we can continue to be as good as we can be and not have to choose between what we have and what we need to do to survive long term.
KNDY has the audio of the Marysville meeting in its entirety available at kndyradio.com. You can also go to that exact same website to listen to this public affairs again. Thank you for listening. This has been Katy Jeter with the Public Affairs Program here on KNDY.